One thing patients are often concerned about is whether the adjustment will be painful. Oh, by the way, adjustment is the term chiropractors use instead of manipulation, and definitely instead of ruk and plick. Plainly put though, the adjustment should never hurt. Occasionally, however, when the injury or damage is severe and the patient is in the acute or early stages of the injury, there's a great deal of inflammation and muscle spasm, and working physically on an inflamed and spasmed area can sometimes generate some discomfort. A little bit like doing the stretching and rehabilitation exercises after a fracture can be somewhat painful. Don't worry though, I will always work within your pain threshold, so that at the end of the day you will always be happy to call your chiropractic experience a happy one. Another question that I am often asked is, am I actually at the right place for my problem? Chiropractors are registered with the Allied Health Professions Council of South Africa as neuromusculoskeletal specialists. That is, specialists in the diagnosis, treatment, and ongoing management of conditions affecting the nerves, muscles, and bones. Our specific area of expertise is around the spine, and even more specifically the joints between each set of vertebrae of the spine. Essentially, there are three types of conditions that will affect the spine. The first are pathological conditions. These are serious conditions, such as an infection of the spine, like rheumatoid arthritis, even cancer of the spine. Fortunately, such conditions are rare and have a very different clinical presentation from the other conditions. Secondly, disc-related conditions. In layman's terms, this is often described as a slipped disc. Here, the shock absorber structure that sits between each vertebra bulges, or more specifically protrudes, trapping the exiting nerve root, resulting in severe pain radiating along the distribution of that particular nerve, perhaps down the arm or leg. True disc-related problems are also fairly rare, but not as much so as the pathological conditions. Chiropractic management can be extremely effective for certain disc-related conditions as well. The third, and by far the most common condition affecting the spine, is what is referred to as mechanical sprain-strain problems, or in more technical language, facet syndrome. 9 times out of 10, these are the conditions that chiropractic manages extremely effectively, and that usually present as neck pain, lower back pain, or pain between the shoulder blades, with or without pain radiating into the arms, legs, or chest, as well as certain types of headaches. The problem here is caused from some degree of sprain on the spinal joints, where there are thousands of tiny receptor sites and pain-sensitive structures that become inflamed and can cause severe muscle spasm as a protective mechanism. Probably 90% of my patients have problems related to either the second or third category, and most certainly chiropractic is the modality of choice for these conditions.